Sorry, just getting over something. I tested negative for COVID-19, I swear. Yes, 2019. The year I got to go to school in the kitchen counter in my pajamas and bake bread so as not to contract the virus. I have had COVID-19 though, and I'm sure most of you have too. Show of hands, who here has had COVID-19? Wow, almost all of you. What about the Black Death? Or the 1918 flu? I know none of you have had those. Each of these three pandemics have influenced the world in major ways, and one of them is so recent we are still seeing the after effects to this day, which brings me to my Masterworks topic, people after pandemics. Hello, my name is Stephanie McBurney, and today I will be talking about how pandemics have influenced societies. I will be using three major pandemics: the Black Death, the 1918 flu, and the COVID-19 pandemic, to compare the changes they have made throughout history. Pandemics are brutal things that infect and kill millions of people and change society as we know it, for worse or for better. I also know that personally, I still have not fully processed that we have just lived through a global pandemic, and I hoped that researching patterns throughout three pandemics would help me better understand my own experiences and that of others. So let's begin. Today, I will cover background information, impacts on the workforce, changes in social class, and innovations due to the pandemics. First, when did these pandemics start? Where did they spread? How many people did they kill? We will find answers to these important questions, but first, what is a pandemic? A pandemic is an outbreak of disease that occurs over a wide geographic area, such as multiple countries or continents, and typically it affects a significant portion of the population. The Black Death started in 1346 in China. It killed 200 million people, with the count still rising. That's right, you can still get the Black Death, especially if you live in the Democratic Republic of Congo, Madagascar, or Peru. The Black Death is zoonotic, which means it came from animals. More specifically, it came from a bacteria called Yersinia pestis, which lives on fleas on rats. Over the years, it has spread to all continents except Antarctica, but when it was at its peak during the 1300s, it was in Asia, Europe, and North Africa. Looking at the map above, you can see the path of infection, which is, where is this button? Which is the thicker red lines, closely follows major trade routes, which are the thinner red lines, such as the Silk Road. For 5 house points, who can tell me when the 1918 flu started? Bowen.
1918.
Correct. The 1918 flu's origins are unknown. Possibilities include the US, China, and Britain. We do know it's zoonotic, and it's suspected to have avian origins, most likely in domestic poultry. It is spread to all continents except Antarctica. The map above shows the way the virus spread during its first and second wave. It killed over 50 million people. The 1918 flu went from 1918 to the summer of 1919 and has never come back. The COVID-19 pandemic started in December of 2019 in Wuhan, China. COVID-19 is, you guessed it, zoonotic. Though scientists are still unsure of exactly what caused it, the virus was believed to originate in bats. COVID-19 has spread to all continents except Antarctica and has killed over 7 million people, with the count still rising. You know, I'm beginning to think I should move to Antarctica, like Scott. The government has implemented a variety of protocols that helped keep us safe during the COVID-19 pandemic. Some of the practices implemented were not as effective because it was before we knew how the virus spread. This happened throughout all 3 pandemics. Since COVID-19 was much more recent, we had more knowledge on what to do during previous pandemics. In Canada, some of the restrictions put into place were disinfecting surfaces, good ventilation of spaces, hand washing, closing of public spaces, quarantine, using masks, travel restrictions, social distancing, and proof of vaccination when in almost any public building. In the Black Death and 1918 flu, governments also implemented safety procedures, but during these pandemics, people were not as knowledgeable about what measures to take. So there was not as many, and some of them were not effective. We have just learned that each of these pandemics is zoonotic. They have spread to all continents except Antarctica. They have killed millions, with the Black Death killing the most and COVID-19 killing the least. We have also learned that the ways of managing pandemics have stayed similar throughout the centuries. Another thing that has stayed similar throughout the centuries is pandemics severely impacting the workforce. How have pandemics severely impacted the workforce and its workers throughout history? The hides of cattle went up from the low price to 12 pence, and shoes went up to the price to 10, 12, 14 pence. For a pair of leggings, 3 and 4 shillings. This is a quote from someone who is most likely alive after the Black Death. Much like the inflation we faced after the COVID-19 pandemic, just after the Black Death, prices rose as well. Prior to the Black Death in 1346, the majority of workers were serfs and peasants. Serfs lived and worked on the land of their landlords and had no rights whatsoever. Similarly, peasants were free citizens, but they were usually very poor. Due to the amount of people killed by the Black Death, serfs and peasants were in short supply and could now demand better living conditions and actual money for their work. The rising wages meant that the price of goods was rising as well, because landlords still had to make profit. The 1918 flu killed 50 million globally and overlapped with World War I, which killed 17 million worldwide. The US economy was suffering due to the large number of able-bodied men having either been killed during World War I or died due to the 19 flu. And this left a gap in the workforce to be filled by women. Women had not been able to fight in World War I, which was the main place people were being infected due to the unsanitary and cramped conditions. Research shows that around 175,000 more men were killed by the 1918 flu than women. After the 1918 flu, women entered the workforce more prominently, working in factories and fields they could not work on before, such as textiles. There were around 25% more women in the workforce after the 1918 flu. One of the largest changes COVID-19 brought with it was being able to work from home, full or part-time, with Zoom and remote work. A benefit of being able to work from home, part or full-time, was the ability to move to a location further away from your place of work. And many people did just that. Many people moved to rural communities. For example, I could see this increase in my own neighborhood on Bowen Island. Although Bowen is very close to Vancouver, it is still more rural. On my street alone, 3 families moved in between 2019 and 2022. And one of the families specifically said they were able to move to Bowen thanks to being able to do their work remotely. Working from home is not all good, however. For some, myself included, working at home means less distractions and you can work at your own pace. For others, however, they find working at home insulating and prefer having a social working environment. Some also feel that since their work is in their own home, they can never be away from their work. Show of hands, who here enjoy doing remote work or school? Wow. Who here hated it, or at least disliked it? And who here still does some form of remote work or school today? still a few people. Now, let's keep going. These three pandemics have brought negative change, like job shortages and inflation. These pandemics have also brought positive change, with the Black Death giving workers more rights, the 1918 flu letting women enter the workforce, and COVID-19 creating more flexible workplaces with Zoom meetings and more online tools. However, not everyone had access to online tools. Pandemics hit different people harder. We will now look at how pandemics have made living harder for those with lower incomes and how the Black Death put an end to the feudal system. To understand how the Black Death ended the feudal system, the first thing one must know was, what was the feudal system? The feudal system was a system of political organization in which a serf, which is very similar to a slave, served a lord and received protection and land in return. To put it simply, the king would grant land to the lord, who would grant land to the serf. In turn, the serf would provide the lords with food and services, and the lord would provide the king with money and knights. While serfs were supposed to receive protection, most lords overworked and mistreated their serfs. Now that we've got that covered, due to the large number of serfs and peasants dead from the Black Death, there was a higher demand for their work. Thus, the surviving serfs could demand higher wages from their masters. Serfs could also demand better living conditions, such as food, houses, etc., that they could not demand before, because now, like toilet paper and COVID-19, they were the most coveted resource of the Black Death. Landlords were entirely dependent on serfs to work their lands and make them profit. So once the serf population grew smaller, landlords had a harder time feeding their families, as they could not grow and farm food themselves. They could also not pay the king tithes, which are similar to modern-day taxes, which meant their land and title could be at risk. The better living conditions for serfs and peasants brought them closer to equality in their wealth. This was the first development of the middle class. Feudalism in Europe started declining in the 14th century, but there is no definite date for when it ended. Most European countries abolished the feudal system between the 14th and 18th centuries. While there were other major factors contributing to the end of feudalism, the Black Death played a major role because of the depopulation of Europe, leading to better conditions for serfs and peasants. After the 19 flu, the following decade was known as the Roaring Twenties, and it is portrayed to be a decade of indulgence and prosperity. Many believe the Roaring Twenties were caused by a mixture of relief, joy, and guilt felt by those who had lived through the 1918 flu, as well as World War I, which had just ended. While a lot of good was happening, it wasn't all peachy. While the middle and upper class were enjoying a world full of new inventions and fads, the lower class was suffering, and the wage gap grew. The poor did see some wage increase, but it was nowhere enough to let them live comfortably. However, as the decade went on, the wages began decreasing again due to the overproduction of goods, which ultimately caused the price of said goods to drop. The overproduction of goods meant that people had to make more goods for less money to keep making profit. This caused companies to lay off and decrease workers' wages due to the increased profits. The rich, on the other hand, had their income grow. The 1918 flu caused a significant difference in the wage gap between the rich and poor, largely due to the overproduction of goods. Since the start of COVID-19, the percentage of unhoused people in the Greater Vancouver has grown. According to the 2023 homeless count in Greater Vancouver, which is done every 3 years, the total counted unhoused population in the Greater Vancouver has risen by 1,200 116 people, or by 33% since 2020. With the population being 3,634 in 2020 and 4,821 in 2023. In a survey new for 2023, 15% of unhoused people asked said that their housing loss was due to COVID-19. While 15% doesn't sound like much, that's 850 people. COVID-19 has also contributed to the rise of unhoused populations by exacerbating the main causes that would lead someone to become unhoused. The top 3 causes of unhoused populations in Canada are finances. This could mean factors such as inflation, which has risen post-pandemic era, housing prices, which have also risen for renting and buying and available housing, abuse, which could have worsened because of spending increased amounts of time inside with the abuser due to quarantine and during stressful times, which can bring out more anger and violence in some cases, and poor mental and or physical health. Examples include drug use, mental health disorders, and unemployment due to disability. The stress and fear caused by COVID-19 could have worsened already existing mental health disorders and caused others to develop. For those with disabilities or who are immunocompromised, if they had COVID-19 as a prolonged sickness, it could lead to loss of job and income. COVID-19 can also turn into long COVID, which can become a disability in some cases. The Black Death, 1918 flu, and COVID-19 pandemic have all made waves throughout the classes, with the Black Death causing the end of the feudal system due to the depopulation of Europe, the 1918 flu causing the gap between the rich and poor to grow with the overproduction of goods, and COVID-19 causing a rise in the Greater Vancouver's unhoused population. With all these changes in society, people needed to create new inventions to keep up. The Black Death, 1918 flu, and COVID-19 pandemic have all spurred or enhanced great inventions. But what were some of the most notable? These 3 pandemics have exposed the demand for something we didn't know we needed or didn't know how much we needed. An important detail to note, which has not been mentioned previously, is that following the Black Death, there came a period of time called the Renaissance. During the Renaissance, people rejoiced over their own survival. The Renaissance began in the 14th century, during or closely after the Black Death. The exact time is still uncertain. During the Renaissance, many notable innovations came into being, but 2 of the most notable were the toilet and the printing press. One of the reasons the Black Death spread so quickly throughout Europe was due to poor or even lack of sanitation. Prior to the invention of the toilet, people would use a chamber pot. Chamber pots held excrement which could then be emptied out onto the streets. In cities and other crowded places, this excrement had viruses. The excrement also attracted rats carrying fleas containing the Black Death bacteria. A more sanitary system was the water closet that had a raised cistern and a small downpipe through which water ran to flush waste. This system was invented in 1596 by Sir John Harrington. Though, yes, maybe. Though they did not gain popularity until the 1800s, this was a large step towards more sanitary conditions in cities and towns. Another life-changing invention was the printing press. While there have been variations of the printing press throughout history, the invention of the first printing press is credited to Johannes Gutenberg in 1436. The printing press allowed the widespread distribution of information because before the printing press, each book or any piece of writing was handwritten with meticulous detail. The Black Death played a role in the invention of the printing press in a couple of ways. one of which was that hundreds of monks died during the Black Death, and during medieval times, monks were the primary scribes for Bibles, which gave inventors the motivation to find another way of copying text. The second way was that after the Black Death, people began using the clothing of the deceased as paper, which was much cheaper than the alternative, which was sheep or calfskin. Finally, because the lower class were earning more money and could afford to buy books, it led to a demand for them. Having reading material more easily available led to more and more literacy among people of all classes, and led to more people being educated. It also helped people spread their ideas and beliefs more quickly, which contributed to the end of the feudal system. Like most pandemics, one reason the 1918 flu pandemic was so deadly because there was no vaccine available to prevent it. In fact, there was no flu vaccine at all. The 1918 flu was what gave scientists and doctors the push they needed to start. During the 1918 flu, scientists were trying to invent a vaccine to prevent the virus, but they were missing crucial information. Bacillus influenza, which I probably didn't pronounce right, is a term coined by a German scientist in 1892 when he found bacteria in the noses of infected people. But what they couldn't see was that influenza was caused by a virus. The discovery of influenza A was the first step towards making an effective vaccine. In the 1940s, US researchers developed the first inactivated influenza vaccine. This vaccine was bivalent, which meant it targeted 2 different strains of the virus. In 1945, the US approved the new vaccine for testing on soldiers, and in the late 1945 to 1946, it was approved for the general public. The enhanced interest in the flu vaccine in the scientific community spilled over into researching other vaccines, and so the 1918 flu pandemic indirectly led to the earlier development of other vaccines, such as those for polio and measles. While COVID-19 was the cause of many inventions, one of the most notable things it did in the way of innovation was to accelerate the development of artificial intelligence and how much we depend on it. One of the ways COVID-19 furthered the development of AI was in education. During the early days of the COVID-19 pandemic, most schools needed to quickly switch from in-person to virtual learning. And while the speed they did that was remarkable, lesson plans did suffer. Post-COVID-19, AI can do various tasks, such as make study guides, help teach children languages, and even act as a sort of virtual tutor in some cases, such as maths. AI can also help processes in the schools other than learning run efficiently. One school, for example, used AI to automate their roll call process and has seen greater attendance and data accuracy since. Another example of this was at Island Pacific School, when I was given a test and the last question had been created by ChatGPT. In fact, I think this has happened twice now. Thanks, Adrian. Another cause of accelerated AI development was because of the increased use in healthcare professions. Due to social distancing, healthcare professionals had to come up with ways to see their patients virtually without being physically close to them. Various companies, for example, Zoom, Google, and Apple, have platforms that let patients do just that. It is becoming more and more common that patients are using virtual healthcare, prompting enhancements in telehealth. An example of this is a chatbot created by a healthcare organization that answers basic questions that patients have and helps schedule appointments. The detection and diagnosis of COVID-19 and other diseases by doctors is now being aided by AI. It is also being used to help interpret MRIs and other imaging systems as well. Each of these 3 pandemics have spurred and enhanced inventions and advances, with the Black Death leading to the invention of the toilet, increasing sanitation, and the printing press increasing education. the 1918 flu, leading to the modern flu vaccine and others, and the COVID-19 pandemic, accelerating AI development, which has let AI assist medical professionals and teachers in a variety of ways. When I first started this project, I thought that pandemics had an overall negative impact on the world. But now, as I finish this project, I realize I was wrong. Pandemics are an awful phenomenon that cause sickness and stress and fear, but they also bring necessary changes and improvements. Looking at the COVID-19 pandemic in particular, and learning about the experiences of those around me through interviews has let me come to terms with the fact that we have just lived through a global pandemic. And while it was not the worst pandemic in history, it has and will influence our society for years to come. I would like to thank my external advisor and close family friend, Dr. Jake Honorat, who provided me with ideas to enrich my paper and great feedback as I went along, my internal advisor, Carrie Marentet, for providing me with feedback, ideas, and editing to help improve my writing and grammar and helping me with this presentation, to Jennifer Henriksen, who helped keep our whole class on track and edited all of our papers while having Masterworks kids of her own. My interviewees, I forgot to talk about this. I did interview people as a part of my research. If you want to ask, do that during the questions. My interviewees, who shared their personal experiences with COVID-19, even if they had never met me before, your interviews were very useful. My parents, who helped me with grammar and provided ideas and snacks, as well as feedback on my presentation. My friends, who provided me with feedback when I asked and emotional support. And to my lovely audience, thank you for listening to my presentation.
Miss McBurney, you have done an incredible job. For the audience here, I need you to know that she has combined what she's learned potentially through her classes at IPS, but also there was some great INS information here, some science information here, and a really critical eye and some critical thinking and analyzing by bringing it all in. I love that you had key points for us to follow through what you were doing. So I think this was all of this information, of which there was a lot, was presented in a way that I think all of us can really understand. And your conclusion echoes my conclusion that you have found the good in something that we usually see as bad. So well done, Ms. McBurney. So for question period, we're going to start with the advisors, and then if you have a question, raise your hand, and then you're going to come to the front here with a mic and pick up your question. So go ahead, advisors.
Sure, I'll start. Excellent job, Ms. McBurney. It was such a pleasure working with you throughout this whole journey, and I hope you feel really proud of yourself. I feel really proud of you. This was amazing to watch. You're a phenomenal speaker also, on a very serious topic. You made it fun, and that's hard to do. So I have a couple questions for you. Because of time constraints and that, we only had time to focus on 3 pandemics. So if you were to focus on another pandemic, what would you have included?
I would have included smallpox, although it's technically considered an epidemic, because it came to North America from settlers, sometimes intentionally, and seeing how it affected Canada's Indigenous population and relationships between settlers and Indigenous people, especially as we're moving towards truth and reconciliation, I think would be very interesting.
Okay, thank you. One more question. Could you see yourself in your future working maybe in something based on this topic, either in the field of sociology or as a disease specialist or anything related to this topic?
I think I would like to work in the field of anthropology, because that's really like analyzing the history, and I found looking at the past pandemics, the Black Death and the 1918 flu, a little bit more interesting than COVID-19, so maybe more anthropology.
Okay, thank you.
So while you were speaking, I was Googling real estate in Antarctica. And it turns out that it's not only considered a continent, but it's also considered an island. And I noticed when I was taking a ferry here yesterday, Bowen is an island.
Wow.
Stunning information. So how do you feel that the fact that Bowen is an island either muted the effects of the pandemic on you and your family, your schoolmates, or exaggerated the effects?
I think for me personally, it kind of muted them because we have so much outdoor space, hiking, swimming, all of that. I think just having like a lot of outdoor space muted the effects somewhat.
Good.
Okay, questions from the floor, probably lost. Go ahead, Scott.
Well, I can't resist the invitation to ask the question, but first off, kudos to you. That was just so informative and well presented. Bravo. Please tell us or tell me about the people that you interviewed on your pursuit of this journey.
Well, I interviewed tons of people. I interviewed students in and outside of IPS. I interviewed teachers in and outside of IPS. I interviewed someone who had elderly parents taking care of them during COVID-19. I interviewed someone who's, she works on the downtown east side. Yeah, an outreach worker on the downtown east side. And probably one of the most informative interviews, her, and I interviewed an infectious disease specialist who works at St. Paul's Hospital and learned a lot about that.
Is there any particular learning that you took from those interviews that informed your presentation and research?
Yes, actually, one thing that I did was I asked about specialties and stuff, but I also asked about just their experiences as a person. And what I noticed was all the people I asked said that COVID-19, either helped them or they stayed the same financially, which I thought was interesting. But I realized, of course, all the people I'm asking are in very good situations where they didn't have to worry. And that gave me some perspective a little bit, because I know, yeah.
Thank you.
Ms. Brenda?
Great presentation, Ms. McBurney. I was wondering why you only focused on Eurocentric demographics for your research.
Why, thank you for asking, Abby. Well, there's a couple of reasons. One, because finding information for some of these, like the 1918 flu, you have to go down some pretty deep rabbit holes. But on the other hand, also for COVID-19, I tried to keep it, I think, as relevant to this audience as possible by focusing on Canada, Vancouver, Bowen. So you could all kind of have that on a personal note. And then the 1918 flu, I also wanted it to focus on Canada, but apparently, according to the internet and books, it only happened to America. So that kind of happened. And then the Black Death, it's really impacting, I really want to look into the feudal system, which was more European, but if I had more time, I wanted to look at also how it led to the collapse of the Mongol Empire. Also, if I was to switch things around, I would have done just COVID-19 and then looked at effects over the 6 continents inhabited by people.
Well, you've got your work cut out for you.
No?
Come on up, Pam.
Thank you so much, Ms. McBurney. That was really impressive. I was blown away by the depth of the scope that you covered on this. It was surprising to me that you could cover so much. And I love the science part of all of it. I really enjoyed that, learning about the vaccine. Can you tell me, I don't know if you really covered this, but what do you think ended all three of the pandemics? Like, it's amazing to me with even COVID-19, I thought it was going to come back with a more powerful virus, so maybe it still will. But how do they figure out, how do they end?
Okay, I have like a whole section of this in my paper, so I'm glad someone asked. So for the Black Death, I kind of looked into it. It was just kind of, it had waves that would come and go. And eventually, I believe one of the last big waves was in England, and there was a large fire which killed a lot of the disease, and it just sort of faded away. And you can still get it. The 1918 flu, it's a little bit unclear, but most people believe it sort of mutated into something else and is now just like a common strain of flu. And then COVID-19, this one's like a big thing. Has the pandemic ended? And according to WHO, it's no longer considered a PHIC, which is, what is that? It's something about like global national state of emergency. It's no longer that, but it's kind of unclear when exactly it's ended. It's also kind of like a mental thing if you feel the pandemic has ended. Because if you're in a place with a lot of COVID, you might feel you're still in the midst of a pandemic. But here, it's over.
Well, hopefully the vaccines really did have an impact on improving the pandemic. And I wonder if the Black Death, a lot of the things they learned, the mask wearing and sanitation, did help, when they figured out the link between the rats and the fleas, maybe they started to clean up
Oh yeah.
a little bit. Anyway, thank you very much. Ms. Rose.
Amazing job, Ms. McBurney. I was wondering, what is your opinion on vaccinations?
Well, so personally, I think vaccines have a lot of benefits. They help protect you from getting illness, and if you do get an illness, it shouldn't be as severe. But I do understand that for certain people, for health reasons or heavy religious reasons, do not get vaccines. It's really up to like what you and your family thinks is best.
Ms. Sabo. Thank you, Ms. McBurney. Amanda, can you come up to the mic and start your work?
Thank you, Ms. McBurney. That was great. Just a question, other than noticing new neighbors moving in, what were some of the things do you feel it changed the community of Bowen in any specific ways? Or not?
Well, I know like certain businesses were like really scared of COVID-19, and that did impact their relationship with the public a little bit. I remember that happening, but I think Bowen has stayed pretty unchanged. I haven't.
I was so impressed and blown away by not just the information you had, but the presentation, the perfect balance of entertainment and info. I had a question: which side do you find yourself more fascinated in? The social sector aspect of it, or the actual diseases or science of it?
I think I'm a lot more interested in the more social side of things, looking at how people interact. The diseases and what they do is interesting, but socials I find a lot more engaging.
Mr. Carter, this is the incoming head of school. It's Fancy Doug's from the last
Masterworks up here. Mr. Golosowski and the t-shirt from Zavos. So Mr. McBurney, thank you so much for that presentation. I thought it was beautiful actually. And what I mean was I could see you were playing with the complexity of something. A lot of people think a pandemic is a horrible thing, and it is, but you were going to go and explore something else and look at this in a much broader way. What was really interesting is just yesterday, I was meeting with a woman here, Elizabeth Moore, who's the executive director of the Independent Schools Association of BC. So it's about 26, 27 of the top schools in the province. She was visiting. And we said the same thing you did, exactly word for word. Like, we haven't yet processed this global pandemic called COVID-19. So I'm wondering, where do you think we're going with this? Everybody, I think, is feeling that. But your sense of what's yet to come yet? Do you have any sense? You gave us a picture of what happened after the Black Death and what happened after the Spanish flu at the end of 1918. But what are we trying to process? What are we trying to have any idea?
Oh, kind of. Yeah, well, it should be like more talked about in schools and stuff, because a lot of the time you kind of gloss over it. This also happened in the 1918 flu, because after the 1918 flu, there's just like the roaring 20s where everyone's kind of trying to push it out of their mind. The same happened with the Black Death and then the Renaissance, and we're in that stage now, but eventually we'll be coming back to it and doing more documentation and that sort of thing.